Good morning, Grenada, Carriacou, and PT Martinique, members of the diaspora viewing online, and of course, the members of the media who are also viewing us online at this time. We want to say special welcome to you all, and thank you for joining us for this morning's press briefing facilitated by the Ministry of Health to provide some key updates on the hospital's statutorization transition to the Grenada Hospitals Authority. This morning, I am joined by the Minister for Health, the Honorable Philip Telesford, and the members of the Hospital Statutorization Transition Team. And I want to invite at this time the Honorable Minister for Health, the Honorable Philip Telesford, to make his opening statements. Minister.
Thank you, Ms. Etienne. Good morning to all of Grenada at home and in the diaspora. Morning to the chair of the Statutorization Transition Team and the rest of the committee and other members who are here present. Morning to you all. This morning, I have the privilege to address a transformative initiative that will reshape the future of healthcare delivery in our nation. The conversion of our state-owned hospitals into a statutory body. This is a milestone moment for Grenada, Carriacou, and PT Martinique, and I am privileged to guide this process as your Minister for Health. Why statutorization matters. For far too long, our hospitals have operated under constraints that limit the ability to respond swiftly and effectively to the healthcare needs of our people. While our healthcare workers have shown extraordinary dedication, they have often been hampered by rigid bureaucracy, delayed procurement, cumbersome financial procedures, and administrative bottlenecks that belong to another era. Statutorization is about liberation. Liberating our hospitals to function with agility, efficiency, and responsiveness that our population deserves in the 21st century. Under a statutory body model, our hospitals will gain operational independence while maintaining public ownership and accountability. They will have the authority to make timely decisions on staffing, procurement, service delivery, and resource allocation, all within a framework of robust governance and transparent oversight. This means that faster procurement of essential medicines and medical supplies. It means better recruitment and retention of skilled healthcare professionals. It means maintenance issues addressed promptly rather than languishing in bureaucratic queues. It means clinical decisions made by clinicians and managerial decisions made by competent administrators with healthcare expertise. The exemplary work of the transition team. I must pause here to pay tribute to the Hospital Statutorization Transition Team, whose dedication over the past year have been nothing short of exemplary. This team, comprising healthcare administrators, legal experts, financial specialists, clinicians, and policy advisors, have approached this task with professionalism, diligence, and an unwavering commitment to getting it right. They have conducted extensive stakeholder consultations, analyzed international best practices, examined our legal and regulatory framework, and developed comprehensive policy recommendations that are both ambitious and practical. They have engaged with hospital staff at all levels, listened to concerns, incorporated feedbacks, and crafted a transition roadmap that is thoughtful, phased, and realistic. The quality of their work reflects their understanding that this is not merely an administrative exercise. It is about the health and lives of our people. Their policy framework balances autonomy with accountability, efficiency with equity, and innovation with our cherished principle of universal healthcare access. To every member of the transition team, Grenada thanks you for your work, which will be echoed through generations of healthier Grenadians. Benefits for our people. Let me be clear about what statutorization will mean for ordinary Grenadians. It will mean shorter waiting times through improved scheduling systems and resource management. It will mean better availability of medications and supplies through streamlined procurement with proper inventory controls. It will also mean improved quality of care through investment in equipment, training, and clinical governance systems. It means enhanced patients' experience through customer service improvements and modernization of our facilities. It also means greater transparency through regular public reporting on performance indicators and health outcomes. And finally, it means stronger accountability through a governing board with clear mandates and measurable targets. Addressing concerns. I am aware that change can provoke anxiety. Let me address these concerns directly. This is not privatization. Our hospitals will remain publicly owned, publicly funded, and committed to providing healthcare as a right, not a privilege. Healthcare workers' rights will be protected and enhanced. The statutory body will offer better career development opportunities, improved working conditions, and fair employment terms within a modern human resources framework. Services will remain accessible and affordable to the population. Our commitment to universal healthcare coverage remains absolute. The path forward. The transition team has delivered a solid foundation. Now comes the implementation phase, which we will undertake methodically and transparently. We will establish the legal framework, constitute the governing board with individuals of integrity and competence, develop operational policies, and ensure adequate funding mechanism. Throughout this process, we will continue to engage stakeholders, healthcare workers, unions, patient advocate, and the public, because this transformation belongs to every single one of us. a vision for healthcare excellence. My fellow Grenadians, we stand at a threshold. Behind us is a healthcare system that has served us but has outgrown its administrative structure. What is before us is an opportunity to create a modern, responsive, efficient hospital system that can adapt to emerging healthcare challenges, embrace technological advances, and deliver the standard of care that our people deserves. Thank you.
Thank you, Minister, for your opening statement. Indeed, it was well received, and I do hope that we continue to update our nation as time progresses, creating a modern and responsive healthcare system. And I like that, and I want you to take that in and remember that that's the vision for our Ministry of Health as they continue to serve the people of Grenada, Carriacou, and PT Martinique. Now, I'd like to invite Mrs. Lucia Andel, chairperson of the Hospital Statutorisation Transition Team, to speak to us on the operations of the team.
Honorable Philip Tillesford, Minister of Health, Madam Press Secretary, members of the media, fellow team members of the HSTT, good morning. It is my pleasure to provide members of the media, and by extension, fellow Grenadians here at home and in the diaspora, with an update on the establishment, functioning, and accomplishments of the hospital's statutorization transition team, hereafter referred to as HSTT. HSTT is a team of professional Grenadian nationals appointed by Cabinet to oversee the transition of public hospitals and related health facilities to a new governance framework as a statutory body. Hospitals and facilities earmarked for statutorization are the General Hospital, the Princess Alice Hospital, the Princess Royal Hospital, the Mungay Psychiatric Hospital, the hospital's laundry services, and the Central Medical Stores. In October 2024, the Minister of Health announced the policy intent of the government to embark on an ambitious healthcare reform program. One such reform included the decision to establish a statutory authority to administer and manage public hospitals and related health facilities in order to improve efficiency and to allow for greater financial flexibility and clinical accountability. In April 2025, the Cabinet established the HSTT with a mandate to oversee and implement the statutorization of Grenada's state-owned hospitals and related facilities, either under the existing Grenada Hospitals Authority Act, Cap 130A of the Revised Laws of Grenada 2010, or under new legislation to ensure a seamless transition. Now I introduce my team. The HSTT comprises of the chairman, yours truly, Lucia Livingston Andel, our secretary, Mrs. Aldin Henry Bishop, and our members, other members, Mrs. Winnet Baker, Dr. Roxanne Brizan St. Martin, Mr. Philbert Lewis, Mrs. Marilyn Austin Cador, Mr. Damian Dolland, the PS in the Ministry of Health, Ms. Rhonda Jones, the PS in the Department of the Public Administration, Mrs. Lindona Hille Marshall, and Dr. Brendan Lagrenan. Some of our team members are here with us this morning. Mrs. Gemma Bain Thomas served as the Chief Execution Officer for the HSTT for the period May 2025 to July 2026. The key deliverables required of the HSTT are a comprehensive transition plan with timelines, budgets, and milestones, legal and policy recommendations to align the existing legislation with current needs, operational guidelines for governance and hospital management under the new statutory authority, public communication strategy to address concerns and build trust, and of course, submission of progress reports to the Ministry of Health and to Cabinet. I am pleased to report as follows. Over the last 16 months, HSTT has held more than 30 team meetings and undertaken in-depth analyses of the current operational situation of the public hospitals and other health facilities earmarked for statutorization. In order to facilitate our work and to make it manageable, members of the HSTT were divided into 5 thematic working groups: legal and compliance, finance and procurement, human resources and staffing, systems and operations, and stakeholder engagement and communication. While there have not yet been much comments and dialogue externally, members of the thematic groups have been diligently working and have to date undertaken detailed assessments and compiled reports with recommendations for the successful implementation of the HSTT's mandate. In July 2025, the HSTT convened a planning workshop that was attended by 75 healthcare officials, both current and past, to build stakeholder alignment around a phased and people-centered transition. The workshop produced several key outcomes and insights, which I will share with you. First one, a broad agreement that statutorization is essential to strengthen governance, workforce management, and service delivery across Grenada hospitals and related health facilities. It established a commitment to a phased, transparent, and people-centered transition that safeguards staff rights and ensures service continuity. There was agreement on critical enablers, the need to modernize legal and governance frameworks, centralize key support functions, and embed performance and accountability mechanisms. And there was alignment on the next steps. The need to develop and resource a detailed implementation plan and launch a structured stakeholder engagement program to sustain momentum and trust. Following this, the HSTT accordingly engaged the Tony Blair Institute to assist us to develop a comprehensive and actionable transition plan to guide the statutorization process. This transition plan, which has been approved by the Cabinet, proposes a 3-phase approach to the statutorization process, with phase 1 ending with the passage of the legislation, phase 2 ending with the appointment of the board of directors and key executive staff, and phase 3 ending with the launch of the statutory body and the transfer of staff, assets, and liabilities. We now move to legal and policy recommendations to align the existing legislation with current needs. The team, after careful analysis and on the recommendation of the Legal and Compliance Thematic Group, took the policy decision and made the policy recommendation to the Cabinet that new legislation should be drafted to enable the statutorization process for the following reasons. The Hospital Act of 1953 is outdated and not fit for purpose, and was repealed by the 1998 Hospital Authority Act. The provisions of the Hospitals Authority Act of 1998, which has been passed in the Houses of Parliament but not brought into force, do not reflect modern governance, financial, or data protection standards, and will require significant amendments to conform to same and to address the issues relating to staff transition. New legislation will consider the major reforms taking place in the health sector, such as a new hospital with teaching and research facilities being undertaken under the Project Polaris, the National Health Insurance, and digital transformation. Dedicated legislation pertaining to the procurement, storage, and distribution of pharmaceuticals and medical consumables could enforce minimum stock levels, mandatory reporting mechanisms, and supply tracking. With that decision taken, therefore, it was necessary to develop a comprehensive policy on hospital statutorization to guide the drafting of the legislation. The draft policy was completed in June 2026 and endorsed by the Cabinet for consultations with external stakeholders and to commence the process for the drafting of new legislation. The consultations were held in July, and the drafting of the legislation commenced in August. Receipt of the first draft is expected by the end of September 2026. We wish to point out that the passage of the Grenada Hospital Authority Act in 1998 constituted an attempt to statutarize public hospitals in Grenada. The Act provided for the repeal of the Hospital Act of 1953, which I mentioned earlier, and established the Grenada Hospital Authority to govern and manage public hospital services, thereby removing the said services from direct oversight by the Ministry of Health. The 1998 Act, however, was never fully brought into operation. Among the reasons posited for the limited success in the attempt to statutarize public hospital at that time was a lack of proper planning, the lack of involvement of key stakeholders, which led to misunderstandings about the policy requirements and priorities, and legal, constitutional, and industrial relations challenges regarding the transitioning of public officers appointed by the Public Service Commission to the Grenada Hospitals Authority. Therefore, in the year 2000, the then government announced its intention to establish an executive agency to provide for the management of hospital services. This was proposed as a hybrid system, embracing elements of the models of delegation and decentralization, and was promoted as another initiative for achieving greater efficiency and improving the quality of care at public hospitals. This initiative, however, was very short-lived. The government and the HSTT are cognizant of the previous attempts at statutarization, and therefore are proceeding cautiously to ensure that a similar outcome is not repeated. We are confident that the approach taken to date has resulted in more in-depth analysis of the existing situation and has better positioned the government and the HSTT to tackle issues that previously prevented successful implementation. We are desirous of a seamless transition to a statutory status and recognizes that this process must be carefully managed to ensure, one, continuity of hospital services. Secondly, we must at all costs protect employees' rights. Must ensure a preservation of institutional knowledge. There must be legal and pension compliance. There must be workforce stability and industrial harmony. Accordingly, a human-centered and consultative approach to the transition process has been adopted. The situation relative to public officers and particularly pension rights now seem to have been reversed following court rulings and the payment of pension and gratuities to affected public officers. Government has also passed into law the 2025 Public Sector Employee Pension Act, which guarantees a pension to employees not appointed by the Public Service Commission. So from all indications, the pension issue has been settled. Government is in the process of regularizing a significant number of hospital workers. These existing staff members now have a fair and reasonable expectation to be regularized before they are transitioned to the statutory body. We now move to another major responsibility, that of the communication strategy. Another key deliverable of the HSTT is a public communication strategy. Engagement with the unions representing workers at the health facilities earmarked for statutorization commenced in June 2025 and is ongoing. A series of meetings with internal stakeholders or staff at the health institutions commenced in March 2026 and is ongoing. Today, August 19th, 2026, marks the official commencement of engagements with external stakeholders. A series of consultations with key stakeholders in small groups is being planned together with larger town hall-like meetings throughout the state. Part of the communications and information sharing activities includes the launch of a national competition to name and brand the new entity to reflect the vision for improvement in hospital services to world-class delivery standards. This is intended to engender broad participation through information dissemination in order to get public buy-in. We invite you to be on the alert for the launch date and to participate fully. Let's now move to operational guidelines for governance. The finance and procurement and systems and operations thematic groups have completed their assessments and provided comprehensive reports which will be available on our soon-to-be-launched website. A financial report on transitioning the hospitals to a statutory authority, which incorporates proposed transition cost based on the 2026 estimates of revenue and expenditure, and strategic recommendations derived from the thematic group's analytical findings has been made available to the Ministry of Finance. The HSTT and the Ministry of Finance will soon convene to discuss the most appropriate financing model for the statutory body. The Systems and Operations Thematic Group also produced a report providing a frank domain-by-domain summary of what the operational and clinical systems look like today, what the baseline recommendations are to ensure continuity through the transition, and a clear phasing framework that separates what must be in place before day one from what appropriately falls to the incoming management and board of directors to procure, configure, and lead in preparation for year one of operations. This report was discussed with the senior management of the hospitals. The HSTT has scheduled a retreat with senior managers of the hospitals earmarked for statutorization to develop an operational budget which will inform financing for year one. And this retreat will be held on the 24th and 25th of this month. So our next steps. As mentioned, today, the HSCT launches its stakeholder engagement and communication plan. Over the next few months, there will be extensive consultations to inform, educate, and raise awareness of the process for the transitioning of public hospitals and related health facilities to a statutory governance framework. On receipt of the draft legislation, further consultations will be held. Phase 2 of the transition plan is activated post the passage of the bill through the various stages in Parliament and assent by the Governor General. This will pave the way for the appointment of the Board of Directors, Executive Management, and the transitioning of operational management to the new statutory entity. The HSTT encourages members of the media and the public to visit its soon-to-be launched website and to keep apprised of developments pertaining to the policy decision to transition public hospitals to a statutory body. Thank you.
Thank you, Ms. Andel. I see your voice did make it. Thank you so much for your thorough presentation. I noted one thing in particular that I want to highlight and commend the team for. In 1998, there was an attempt to statutarize our hospitals. So I want to note that. And one of the reasons that you gave was a lack of stakeholder engagement. And I want to commend this transition team for seeing the importance to engage the public and engage stakeholders, because we know that is important. We cannot do it alone. And that is very highly commendable. So I want to thank you for that, and thank you for highlighting that as well. And again, I want to thank you for ensuring the continuity of the hospital services. You made note of that, protecting our employees' rights. You mentioned pension, and I think that's important, and we want to highlight that in 2025 we did take the Pension Act to Parliament, so our workers are protected under that Pension Act, legal and pension compliance, and of course the human-centered approach. I think that is also highly commendable, and Grenadians are happy to receive that information this morning. And we want to encourage you to look out for the website. Those of you viewing, the website will be launched soon, and as of today, the public communication strategy has been launched to largely engage the public, so look out for that as well. You also noted that the financial reports will be made public once that is finalized. So a lot to look forward to, and I want to thank you once again, Mrs. Andel, for your thorough presentation. I do have 3 questions that came in to us via our social media platform, which I'm going to try to get you to answer. You can stay where you are. So the questions, when does year 1 begin? We may have missed it. I know you mentioned, we're getting ready for year 1, but if you can tell us, when does year 1 begin?
I deliberately did not give a time, but rather said what will comprise year 1, what have to be in effect, what must precede year 1. So phase 1 will end with the passing of the legislation. Phase 2 will end when the board of directors are in place and the staff and the executive management have been appointed. And then phase 3 will end when there is full transfer of the assets, the liabilities, and the staff. Now, preliminarily, in our old plan, there were dates attached. Unfortunately, there have been some slippage in terms of the time, and now it will be highly dependent on when we can get the legislation passed. We are hoping to get it to the Parliament in the October sitting.
Nice.
If that happens, then we can strike perhaps for the first half of 2027 to have everything fully implemented. But of course, it's dependent on going through the Parliament with the legislation. We're not quite sure what's going to happen there and how many iterations there might be before it's finalized. So these are the dependencies that will dictate the start date.
Thank you. That brought some clarity. Next question is, how many new clinical or positions or non-clinical positions will this statutorization create? If it will create any, or if there will be a repeat of, if you're going to just rehire existing hospital professionals? Or any member of your team could answer that.
Okay, so I'll assist here. We have begun the process of recruiting top managerial positions to assist us with that shift, with the reorganization. And it is very important for us to appreciate that there must be that paradigm shift for this to be effective. So we are in the process right now of hiring an interim CEO. So we have had some applications. We have done most of the screening. We have done some interviews. And I believe in short order, we will be in a position to make a decision. And the team is involved in that process. So that is happening. We have already engaged or hired a director of human resources. We've never had that position filled at a hospital before, and that has already begun to yield dividends for the operations of the hospital. So staff matters and strategic planning at that level, HR planning, can happen now and really does add to the team. We also have hired in a chief engineer, again a very critical position. That person has already started work, and again it is yielding a lot of dividends for us. We have a financial controller, chief technology officer, and others that will have to fill those strategic roles. Mm-hmm. And coming on those strategic roles, we will have, for example, HR. It is only evident that we will have to have an HR department to treat with all of these hundreds of staff employed at the hospital. So that's another skill set that we would have to hire in. And what is going to happen is that in a number of areas we would have to do training, retraining, and hiring in of the skill set that is needed. So, as it said, a rising tide lifts all ships. So that is going to happen in almost every department going forward.
Yes, that was going to be my next question. But just to piggyback on it, how will the existing staff be upskilled or trained if on new systems, provided that you do? I'm assuming that you will have modernized system being introduced. So how will the new staff or existing staff, be trained or upskilled on any new systems, infrastructure, operational protocols that will be introduced? And that's the final question.
Right. Training is an ongoing process that will continue to happen. And healthcare environment is an environment that requires high level of training and continuous professional development. So that is an ongoing process. You will know that the government had paid for and continue to pay for 6 doctors who are going to specialize in areas, in different areas, and that is going to be an ongoing process. So it's not just that at all the various levels, procurement, biomed, in all the various areas, nursing, administration or administrative positions, all of these areas will require some level of training. As a matter of fact, I can say safely that there is going to be system-wide training, because there has to be a paradigm shift. The way we do business simply cannot continue in a new statutorized professional environment or modern environment, so to speak. So there is going to be that training. I don't know if you want to add anything more. Yeah.
I think it's very important for us to note that this statutorization and all of the other healthcare initiatives surrounding it, such as the building out of the hospital and the national insurance when it comes into place, etc., these are all opportunities that are being provided. So in fact, there's going to be a general lift in terms of the career opportunities, the potential for growth, and we're very excited about that. And that is where a lot of emphasis is being placed on the HR management, and we have brought in the HR director. And in addition to that, even while we are transitioning, we are going to have a HR unit specifically placed within the hospital, just to assist the staff in terms of transitioning, understanding what the opportunities might be, where they can place themselves to be able to move forward in their careers, and also to give them the opportunity to be first in line in terms of any opportunities that might exist before any other person from the outside.
Thank you. Thank you so much. That's all the questions presented before me this morning. So now I will invite the Minister, Chair, if you wish to close with any final thoughts that you may have at this time, you're welcome to join me at the podium to make your final remarks. And we close for this morning.
Yeah. I'm not sure if you can see our banner, but our theme is statutorization to be championed, not feared. And we have done that on purpose because we recognize some of the fears that might have surrounded the first attempt and why it perhaps did not succeed. But as I said before, this is an opportunity for growth, an opportunity for modernization, an opportunity for advancement. And as such, we want to encourage, because when we go out into the various consultations, when we go out to the town hall meetings, etc., please get informed. Ask all the questions that you need so that, in fact, you will be well positioned to be supportive of what is happening. We know that our healthcare professionals have done very well with the resources that they've had over the years. But we also know that we have not served our people in the best way, given some of our inefficiencies in the system. And as such, with statutorization and all of the accompanying other initiatives, we will be well positioned to lift the delivery of healthcare services in Grenada. Thank you.
And now we invite our Minister for Health to close us off.
Thank you again, Neela. The statutorization process is one of the many good things we are doing in the Ministry of Health. But these are very, very important strategic areas that needs to be addressed. And you would notice that we have already invested over a year and 4 months in this process, because it must be carefully studied, carefully undertaken, and executed. And I believe we have the right people who are very committed in this process to carry this forward. There are many other good things that is happening within the ministry, and we call upon the population for their patience as we carefully ensure that the shift that is needed within the healthcare environment happens. All of it would not readily meet the eye, because a lot of the system changes, development of policies and all of the things, the training and all of the things that is happening behind the scenes has to happen in order for the outward manifestation of improvement in service to happen. So I call upon you for your patience. Additionally, the consultative process that will follow. I'm talking about the village meetings, the meetings in your communities. We have to embrace these opportunities. And I use the phrase have to, because of the urgency and the necessity for us to engage our minds, and to the necessity to encourage each other to be part of these consultations, so that your voices can be heard, so that the changes that you have been clamoring for years, for decades, will come in the system. But how can it come? The change that you desire most can come when you let us know what those changes are. We need you to make your voices heard. We will be in every single parish, including Carriacou and Petit Martinique. We will be in your area. I want you to listen for the dates and be part of it, because your voice matters, your contribution matters, and this is how we will shape healthcare in Grenada. I always make the statement to my team that healthcare is not a political issue, it's not a political matter. This is one area of governance that requires professionalism, dedication and commitment. And so we call upon each and every one of you, regardless of your political persuasions, come and make your voices heard. This is about national development, because every single one of us will one day end in the hospital and will require some measure of health care, whether it's in the primary setting or at the hospitals. And if we so do, then we need to shape this together. We need to make this happen together. And illnesses does not respect colors. It does not respect your belief. It does not respect your age. It does not even respect your state of health. So I want to encourage us, please be part of the consultations. The team is well able, and we are very willing to hear what you have to say so that we can make the change that you desire. I believe we've heard a lot from our staff, from the internal people, from the stakeholders that we've engaged in the consultations that we've had internally. Therefore, it's a time for us to start hitting the road. right? So the season is open. It's time for the road. So I want to encourage us to please be part of the consultations. Thank you.
Thank you, Minister. Before we close, it would be remiss of me if I didn't pause for a moment of silence for Nurse Kim Cummins, who recently passed away, a member of the hospital medical fraternity. She was a dedicated mother. She loved her children and she loved nursing. And so at this time, if you would just pause with me for a moment of reflection and a moment of silence for Nurse Kim Cummins. May God be with her family at this time, and we will give her all the support that they need to get through this difficult time. Thank you, Grenada, and members of the diaspora, those viewing online. We want to say special thanks for joining us this morning for this press conference. We want to wish you a wonderful rest of the week. It is Water Wednesdays in the Office of the Prime Minister, and we encourage you to stay hydrated and try to drink only water today. It's good for you. Have a wonderful day, everyone, and we see you next time. Thank you.